sunrise. Now, you're watching Wave 3 News Listens Live.
And it is a celebration.
With your host, Jon Ramsey.
And welcome into the Wednesday edition of Wave 3 Listens Live. We talk about how first impressions are very important, and they certainly are. And it all starts with a smile. Everyone should feel confident about their smile. But you know, having a beautiful smile and teeth that actually function well, it goes beyond that. And that's what we're to talk about today with Freedom Mini Dental Implants. Dr. Regan Ackerman rejoins me again. Dr. Ackerman, welcome back to the show.
Thank you.
All right, let's talk about the possibility, and it's true, if you have a loved one out there who wears dentures, wouldn't it be nice to throw those away? That's one of the things you do.
Yes.
You give them, when you talk about freedom, it's the freedom to get rid of those dentures, right?
Yep, freedom to throw those in the trash and eat again and not gag again and not have to use all that denture glue again. Not have to excuse yourself from the dinner table because, you know, you've got food on all underneath your denture, or you're afraid your dentures are falling out. You know, so many reasons. I see patients every day and hear their stories every day that are struggling with dentures. And it's so rewarding to be able to throw away that denture and do, you know, the permanent teeth with the mini dental implants, which is just a lot less invasive way of doing implants. And sometimes we do a snap-in denture, which can help too dramatically, so you don't have to use denture glue and all that. So.
Yeah, we're going to talk about this because I think it's interesting in that a lot of people, maybe you're one of those who is apprehensive. You agree, all of these struggles with all these challenges with your dentures are true, but you said, you know what, that cost? Ooh, I don't know if I can handle the cost and the extensive surgery and how invasive it is. Well, that's why we love having Freedom Mini Dental Implants on, because the game has changed. And if you're not aware of it, if you went to the dentist 20 years ago and you were told, well, you're going to have surgery and a series of surgeries, and you're going to have to let this bone grow back, and you're going to need this and that, the game has changed. It's a lot like, and we use this comparison often because I think it's very apt, it's a lot like laser surgery in the way that if you had your appendix taken out maybe 30 years ago, it was extensive surgery. Now it's done with a laser, right?
They used to cut you open, you had a big scar, stitches. Now they can do it with a tiny little incision, and it's not major surgery. So that's kind of the equivalent of the mini dental implant. It's just a smaller diameter implant. And so when I place these, I don't have to do any incisions, any stitches, minimally invasive, a lot less healing time, less costly. You know, everything is just in the positive category versus the negative category.
Yeah, and before you came on, before Dr. Stroud came on previously, I said, I'm going to try to look for a negative here to talk about. And I did, and I couldn't find one.
It's hard. Yeah. Yeah, I know.
Less invasive. Yeah. They last just as long. You need less bone. Yes. In fact, I'll tell you what, we're going to kick it off this way. Proof is in the pudding. I want you to meet Sandy. Now, tell me a little bit about your patient, Sandy.
Yeah, Sandy, oh my, dear to my heart. So she came in and was struggling, needed teeth taken out, and could not wear a denture. Major gagger, just couldn't do it. So we did the permanent teeth for her, which is where, you know, there's nothing on the roof of your mouth anymore. It's just like having your natural teeth back. So this is her before picture when I was trying to get her to smile. And so we did the permanent teeth for her, so they stay in. She doesn't have a denture. She doesn't have to worry about denture glue, anything like that. And we got her smile back. And I will never forget the day we cemented her teeth in, because she started tearing up and was just like, they look like my original teeth. And she was just so excited to finally have her smile back, and you know, it was really moving that day. It really was.
I see the genuine, authentic smile. That's really evident. And when you have Freedom Mini Dental Implants, seriously, it is like youth serum. As far as it erases decades, we know how important teeth are, but when you see the difference in the two pictures, they don't even look like the same person.
It does. It does.
The confidence is there too.
Yeah, and I mean, unfortunately, we live in a world where people judge you by, you know, your teeth, and I have met so many people that have tried to do everything right, and they have spent tons of money trying to save their teeth, and for whatever reason, they're still broken down, or they had to have all their teeth taken out.
Genetic.
Yeah, genetics, and they are, you know, they are judged, and they are embarrassed about it, and you know, it is so nice to be able to give people, you know, the opportunity with implants to be able to get their smile back and get that confidence back, and you know, just have that just confidence back. It means the world to people.
I think everyone deserves the right to be able to smile confidently. It's something we all should feel good about, our smile, because it really does. You talk about the windows to the soul, and they say the eyes, but your smile is as well. And you see the genuine smile with Sandy. And we've had many cases, before and after pictures on this show. And the stories are much the same. And this is what I wanted to talk to you about today, is the fact that don't procrastinate. Now's the time. How many times do you hear, and I'm not trying to put words in your mouth, but we've talked about this, that people say, I wish I'd have done this earlier.
Yes.
I wish I'd have known about Freedom Mini Dental Implants.
I hear it all the time. You know, either, you know, their dentist didn't tell them about it. Like I said, it's not new technology. It's been around for 10, 20 years. But so many people, I think a lot of it is fear. You know, they're worried about their procedure, and as much as I can tell them this is so, you know, less invasive, not as much pain, and all those good things, until they do it, do they realize, like, that was it? You know, like I've had a patient when I, you know, placed an implant for, you know, one missing tooth, and I placed the implant, and they're like, that's it? They're like, that was easier than a filling. And I was like, I know. So it really is. And I think, you know, a lot of people are, you know, maybe scared or fearful of it, but, you know, they just need to come in for a free consultation. I'll explain the process to them, show them, and I promise we can get through it together, and it's a lot less invasive than the bigger surgical implants.
Oh, yeah.
A lot easier. We're trying to simplify things with the mini dental implants.
Yeah, the old method, you don't need as much bone. It's a lot less expensive. And if you have a question, if you think you might be a candidate, but you have a question, maybe a loved one, 571-5263, 571-5263. We put a lot of emphasis on having a confident smile. And I think rightfully so. I can understand that. You know, we are superficial by nature, and everyone wants to appear more attractive. But let's talk about the other benefits of not having that denture glue and ill-fitting dentures to where you can't eat the food you love, and it usually involves some crunch. Yes. Right?
Yeah. Everybody wants, you know, those fibrous foods, celery and carrots, and those healthy foods. Steak, your protein. I actually had a patient today. We placed her implants 1 week ago, and she came back for her post-op, and she said, oh, that steak I ate was so good yesterday. And I was like, good, I'm so happy for you. So yeah, because when you have a denture, it's just flopping around, it's moving around, and so many people are using gobs of glue, and all they taste is the glue. So you're right, to be able to eat nutritious food again. You know, I've had people, you know, they lose so much weight because they can't eat, and so after the implants, they come back and they're like, I've gained 10 pounds, but they're happy about it because they're like, I can eat again and eat healthy foods and, you know, not all the sugary bad foods for you. So it affects your overall health. Another thing is a lot of people struggle with periodontal disease. They're losing their teeth because of bone loss, and it's been proven that periodontal disease, you know, affects your heart and the rest of your body.
That's right.
And they're trying to limp along, and, you know, once you can get the teeth taken out and know that you have a better option with implants, your overall health is just going to be better. Yeah,
so you're going to feel better. And think about the nutrients that are involved. I mean, there's a lot to be said for a nice, crisp apple, but the antioxidants, the vitamins that are there, we talk about the iron and steak, it goes on and on. So it's not just about a smile, but believe me, when I see the before and after pictures, that's when I'm always, you know, I'm always like, wow, your work has to be rewarding.
It's very
because
rewarding.
You're changing lives for the better, and for a lot less cost than most people anticipate.
Yes, and people that thought they didn't have an option because they thought it was out of their budget. Now with the mini implants, you know, we're able to put it back within their budget, and we do have financing plans still that, you know, a lot of people use and give them a payment they're comfortable with. So, you know, there's always a way to make it happen.
All right, if you have a question, again, that number is 571-5263. When we come back after the break, we're going to show you exactly why it is less invasive, why it is less costly, and why you may be a candidate for Freedom Mini Dental Implants. 571-5263. We'll be right back. More with Dr. Regan Ackerman after these.
From the greatest of all time to military heroes, we're proud of our rich Black history. Wave 3 News invites you to celebrate Black History Month, honoring Wave Country's Black history makers of yesterday, today, and tomorrow.
We're wrapped in red for the Red Cross's 10th annual Wrapped in Red Gala, February 15th at the Omni.
There will be awesome auction items, food, and a performance by Thompson Square. Get your tickets now. Go to this site for more information.
Hurt in a car? Call Sam Aguiar.
When you're injured, here's what to look for in your lawyer. Someone who fights for you like they would their own family. and has earned a reputation for winning big cases. I'm Sam Aguiar. We're proud of every verdict and settlement we've won because of the difference it's made in our clients' lives and the difference it could make in yours.
Hurt in a car? Call Sam Aguiar, 888-8888.
Welcome back. It's nothing but good news with Freedom Mini Dental Implants. Less invasive, less costly, less downtime, if any. We're going to talk about that, but first of all, we had a question. Someone called in and they didn't want to go on the air with us. We understand, but the question was this. They said they haven't had teeth in 55 years, and they have been told before that they did not have enough bone. Yes. Talk about bone loss and why this is different. Maybe you could show us this little model here, because this is interesting.
Will probably speak volumes. And I've seen that happen a lot, and I have seen patients that have had dentures for 40, 50 years, and I have been able to do implants for them. You know, I will say it's pretty rare I have to tell somebody they don't have enough bone for the mini dental implant.
So here's what we're talking about here.
So
here
yeah,
we go.
but this kind of shows you, it's almost kind of hard to see.
So it's a jawbone, right?
Yeah, so, you know, imagine this is your lower jaw. The big hole is the old method, the surgical
They
implants.
needed more bone.
Yeah, versus if you can even see it, kind of, there's a tiny little hole there, and that's the hole that I make when I place a mini dental implant. So I do not have to have as much bone as they had to have, you know, for the bigger surgical implants. So I'm able to, you know, give people the opportunity to have implants that were told they didn't have enough bone, or they needed sinus lifts, or they needed bone grafts. So this definitely shows you, you know, why the mini implant is a lot less invasive. And why we're able to, you know, help many people out that were told they weren't candidates for implants before. So for that person that called in, you know, I would certainly welcome you to just set up it's a free consultation, and we'll take a 3D x-ray, and we'll be able to tell you if you're, you know, still a candidate for the mini implants or not.
Yeah, so you were telling me it is rare to tell someone no. It has happened. I'm not going to say it's impossible, but it's rare.
It happens, but it's pretty rare that I have to tell somebody they're not a candidate.
That they don't have enough bone.
I mean, I'd say 90-95% of people that come in are candidates for the mini dental implant.
I wanted to ask you about stability then, because I think some people would assume, well, if you don't need enough bone, then how stable is it? And it's titanium, correct?
It's still a titanium implant, just like the surgical ones, and they have a special coating on them so that the bone kind of grows around them and integrates, and you know, that makes them nice and stable and strong.
All right, so it is stable.
Yes.
And so all the news, once again, is good. We go to the phones, 571-5263, if you'd like to call in with a question for Dr. Ackerman. And Barbara has done just that. Barbara, welcome to the show. You have a question?
Yes, I was wanting to ask her, my bottom gums are real thin, and my teeth has never fit me, but I keep trying to wear them and keep places on my gums. And I didn't know if my gums would be my bones under my gums would be too thin to use, you know, for that.
With the implants? Yeah, I mean, over time, you're right. You know, if you don't have teeth, your kind of gums shrink and your bone resorbs and things like that. But all it would take is you know, setting up the consultation appointment, and we take a 3D x-ray. So it will show me your bone and your gum to make sure, you know, you have enough to place the mini implants. But, you know, more than likely you do. Like I said, 90-95% people that come in my office are still a candidate for the mini implants. So the easiest way to answer your question is, you know, call our office and set up a free consultation, you know, because your gum, you may still have enough there even though you don't think you do. So it's definitely still a possibility.
All right, yeah. I think you'll find that the news is good because I've seen a number of these before and after pictures and these really good stories that end well. I think you're going to find for the most part that, yes, you are a candidate. So if you've been hesitant, apprehensive, call them today at Freedom Mini Dental Implants. If it's a loved one, they're going to love you for it.
Yes.
Okay, let's talk a little bit more about Sandy, because I want to show, if you would, show us the procedure, what exactly you did for Sandy and how it works.
Yes. So for Sandy, we did what we call the permanent teeth. So, you know, this model, let's see, shows,
this is not plastic.
Yeah, this
is your mouth.
So imagine the pink part here is your mouth. That's your, you know, your gums without teeth. Okay, and then these are the mini dental implants. So they're just a very small diameter implant. And when I place these, you know, I don't do sedation. I don't put you to sleep or anything because it's very minimally invasive. I don't make any incisions or stitches. I make that tiny little hole that you all saw, and
you numb them up a little bit.
Just numb them up a little bit, and then we place the implants, and then we're able to make just a bridge of teeth, and this will cement onto those implants permanently. It stays in your mouth. You are not taking this in and out. But then you don't have anything covering the roof of your mouth. You get to taste your food again, and you lose all the bulkiness, of a denture. And so this is kind of the closest thing to having your natural teeth back. We say it's like your third set of teeth. You had your baby teeth, your adult teeth, and now you have your implant teeth. So this is the best thing that we do for patients to get them back where they feel like they have their natural teeth back. And this is what we did for Sandy. So we're just placing these implants, and when you leave, you're not bleeding, there's no swelling, it's very minimally invasive placing these implants. And then we cement that bridge onto those implants, and then it's permanently in your mouth. You're going to clean it.
Right?
Yeah. You're going to brush it just like you normally brush, and we give you an irrigator or a water flosser just to, keep it clean around the edge. But it's, just life-changing to be able to not have anything on the roof of your mouth and feel like you have your teeth back again.
You've probably heard quite a few sad stories. People who are hesitant to participate in wedding pictures or, family gatherings, or they don't want to go out socially. And we've all had a friend, someone that we know, someone maybe that you love, before they smile or talk, they cover their mouth because they become very self-conscious.
Yes.
So this is life-changing in such a positive way. 571-5263. You've heard a lot of these stories, right?
Yes, I hear it every day, unfortunately, yeah. But it's so rewarding to be able to change that and, make them not self-conscious about their smile or about their denture falling out and things like that. So
yeah, that nasty glue. What's the biggest complaint you get? Is it the glue, or is it that I don't get to eat what I want, or is it? It's probably different for everyone.
Yeah, but both. Those are the top two: the glue and not being able to keep them in to eat. Everybody wants to eat. Everybody wants to go out to the dinner and be able to choose whatever they want off the menu again, and not have to pick and choose because they're worried about their dentures, coming out.
So show me the other method. Now that's the method that Sandy had.
Yes.
But you may opt for this method, and it's effective as well.
This is a great option, and we do a lot of these, which we call denture stabilization. So basically, this option, we're getting rid of the denture glue, okay? So this is what we call the snap-in denture. Same method, imagine this is your mouth, your gums. We're going to place the implants the same way, going to numb up the gums a little bit, no incisions, no stitches, place the implants, and then that same day that we place the implants, we'll take the denture, put these attachments in there, and then your denture will now snap on to those implants. And this is a great way to stabilize your denture. You no longer have to use denture glue. You can chew better, eat more food with it.
It's secure.
It is very secure. And you will be able to snap it out yourself and rinse and clean it. But it's a great option. I had a patient come in today. It was so tight. She was able to get it out, but she was like, "Oh, it's really in there." I was like, "Yeah, it's in there." And that was the same patient that ate steak like 3 days after we did her implants, and she was so happy. So yeah, this is the snap-in denture, which is a great option. It can be a more affordable option for people. If you already have a denture that you like, a lot of times we can use that same denture. If you have a denture that you don't like, we'll make a new denture and, place the implants in and have it snap on with the mini dental implants. It's a great option, and we do a lot of these denture stabilizations, especially the lower denture. The lower denture is the one people struggle with the most because they get no suction from it. Your tongue's trying to constantly push it out. So being able to have a snap-in denture, it can be life-changing and be able to eat what you want to eat again.
There we go.
Yeah.
So let's grab another phone call. Patricia has been nice enough to call. Patricia, welcome into the show. You have a question?
Thank you. Yes. The permanent ones, is there any problems with getting seeds underneath? And if so, how do you fix that?
So, we try to make it as close to the gum as possible with no gaps. But you know, every now and then something may slide underneath there, and that's why you have that water irrigator. I kind of tell people it's like a power washer for your mouth, but you would use that to clean if anything ever did get caught underneath there, and it would kind of flush that out. So that's a good question. I mean, we definitely make it to where it's, you know, no food can get underneath there, but you know, every now and then there might be something that could slide underneath there, and that's why you have that water flosser and that irrigator to clean it out. So, all right. Great question.
Let's grab another call. They've all been great questions. Charles, welcome in. Welcome to Wave 3 Listens. Thank you for watching. You have a question. Hello?
Yes, how you doing?
Yes.
Yes, how you doing?
Doing well.
Yes, I was interested in would like to know, Doctor, your situation of how long will it take on the procedure of the dental implant from the time that you do your x-ray and all together, and how much more cheaper is it compared to a dentist when you go into the office?
Okay. You know, it all just depends on the scenario when you come in. You know, if you already, you know, if you come in and you're already in dentures and you like those dentures, you know, the next step would be the implants and placing the implants, and you know, be in the office from, you know, maybe anywhere from an hour and a half to 3 hours, depending on, you know, the procedure. And you would leave that day with the denture snapped in. You know, you may be asking if you come in with teeth and you have to have all the teeth, you know, removed. You do have to heal up for about 4 months, but you're never not going to be without teeth. I will make, you know, dentures or temporary. You will have something that you will be wearing for 4 months. But anytime a tooth is taken out, that extraction site has to heal up because you want nice, good, healthy, solid bone before you place an implant. So there is a healing time of 4 months if you have to have, you know, a tooth taken out before we place the implants. But you'll never not be without teeth. We'll make a temporary and things like that. As far as cost goes, you know, that just varies on the treatment plan. I will say the mini implants are usually about a third to half the cost of the surgical implants. You know, I've seen patients come in with a wide range of treatment plans with the surgical implants, and usually our mini implant treatment plan is about a third to half the cost.
And the consultation is free.
And the consultation's free to come in for the consultation and the x-ray. You know, we'll go over the process, the treatment plan, and, you know, our cost, and, you know, it doesn't hurt to come in and see how this works and what your options are.
Yeah. So in a nutshell, Charles, it happens rather quickly. It really does. That process is expedited because it's not invasive. There's no surgery. All right, we're going to take a little break. If you have a question, 571-5263. We'll be right back. The Wednesday edition of Wave 3 Listens Live.
Place your right hand over your heart and the other on a steak knife. A new lineup of American Roadhouse meals is here. That's 10 hearty meals for $8.99. Every day at Logan's, the real American Roadhouse.
As a fighter pilot and a Marine, I was always focused on the mission, and you couldn't buy your way out of a tough spot. Then, as a national security advisor, I was focused on keeping our country safe. I'm Amy McGrath, and now I'm running for Senate because it's clear we need a government focused on doing what's right for regular Kentuckians. We need a senator who fights for things like affordable health care, college, and technical school, not tax cuts for wealthy donors. That doesn't mean free college or Medicare for all. I'm against that. Instead, we can improve the Affordable Care Act with no one getting kicked off their health plan. And I believe in national service as a way to pay for college. We need a government focused on solutions for people who work hard and play by the rules, not the well-connected who can buy whatever kind of senator they want. I approve this message because what good is having a powerful senator if he's not using that power for us?
A message from attorney Mike Sullivan.
Does your employer provide long-term disability insurance coverage? Did you rest easy knowing that if illness or injury strikes, you're covered? So you filed a claim. they're probably going to say something like,
Your problem, it pre-existed.
or maybe, our investigator
Filmed you grocery shopping.
Our in-house doctor looked at the paperwork and...
You are healed.
Don't try and find an insurance company by yourself. Call me.
Call 888-587-0228. Call now.
Every great American deserves a statue. And when you get a taste of our new slow-roasted prime rib, you just might want to stand and salute. Served with your choice of 2 sides. This is what weekends are made of at Logan's, the real American Roadhouse.
Freedom Mini Dental Implants. Dr. Regan Ackerman is here. We've had a number of calls. If you'd like to call in, we'd love to hear from you. 571-5263. One of the questions was about gum disease. Are you a candidate if you have gum disease? Talk to us about that.
Yes, and I treat patients all the time that have been told they have gum disease, also known as periodontal disease. These people have struggled almost all their life and they're losing bone essentially around their teeth, and their teeth get loose and mobile because of the gum periodontal disease. And yes, you know, all the time I treat patients that have had that gum disease and we're still able to do the implants. Because a lot of time it's getting those teeth out that are causing some of that periodontal and gum disease. That's kind of the source of infection. So once the teeth are removed, then your bone heals up nicely and your gums heal up nicely, and you know, it's a perfect candidate for the mini dental implants. So yes, to answer the question, if you've been told you have periodontal disease or gum disease, yes, you can still be a candidate for the mini dental implants.
Yep. Come see Dr. Regan Ackerman. Another question I had was, what are the implants made of? I think you addressed this, what the implants are made of. And they can handle just about anything. So there's no exclusions as far as what you can eat or drink, right?
Right. Yeah. I mean, they're a titanium alloy. Yeah. So they're 98% titanium for the most part. So yeah, but they can handle anything.
All
yes.
Right. And for those of you maybe who have a bridge, what they call a flipper, or you're missing 1 or 2 teeth, maybe it was an accident or something you've had since birth, if you would show us a little bit how that works. Maybe it was genetically, you're just missing a tooth, right?
Right. I did this for a patient recently. She was born without what we call her incisors, but yes, we can do it for just 1 tooth. So yeah, if you had trauma, lost a tooth, or like you said, born without a tooth, we place the implant same way, no incisions or stitches, and then you'll leave with a temporary tooth that day, and then it just has to heal up for a couple weeks, not months like the surgical implants. Okay, a couple weeks later, and then we have the nice, pretty permanent tooth ready for you, and then that cements on to the implant. And then you no longer have a partial or a flipper or whatever it is you may be trying to wear to replace that tooth. And it doesn't have to be just a single tooth. It can be, if you're missing 2 or 3 teeth. I see so many patients that have lost their molars in the back and they cannot chew food anymore. They miss chewing on these, I call them your big chewers back there, your molars. So, we'll just place several implants, and then we have the teeth kind of splinted together, and then that will cement onto the implants permanently in your mouth. It does not come in and out, but then you no longer, if you had a partial before, you don't have to have that partial, the roof of your mouth or that bulky, appliance anymore. And it's just like having your natural teeth back. So we can do 1 tooth, we can do, 2 teeth, 3 teeth, pretty much any situation. We can replace teeth with these mini dental implants.
All right, and before we let you go, we have 30 seconds left here. Free consultation again.
Yes.
How long should they mark out as far as for that consultation? How much time?
30 minutes. Okay. It'll be like a 30-minute appointment.
And it's free.
Yes.
Yeah, and there's the information on the screen. Dixie Hwy is the location, and she's fantastic. She is Dr. Regan Ackerman. And the answer for you or a loved one, again, is Freedom Mini Dental Implants. Again, free consultation. Change your life for the good. Less expensive than you ever dreamed. All right, we're going to let you go today, but we'll see you tomorrow for the Thursday edition of Wave 3 Listens Live. Have a good one.